And hello and welcome to this webinar that is being put on by our Education Roundtable on increasing access to mental health in North Carolina public schools. School psychologists are needed. And I believe this is a very timely topic for us, and I'm very, very pleased that Lee and Mary could join us today. So a little bit about our speakers. Lee Kokinas is a school psychologist who works in the Wake County Public Schools and has since 2006, where she provides comprehensive school psychological services for students in grades K through 8. Lee has a history of being involved in the Wake County Public Schools, promoting school psychology and multi-tiered system of support committees. At the building level, Lee serves on multiple problem-solving teams, including her school's intervention teams in her elementary and middle school. Lee also provides direct support to both students in her middle school by working with small groups of students to build leadership skills and reduce in-school suspensions. She has provided consultation and professional learning to her schools to build understanding of MTSS and social emotional learning. At the state level, Lee is active in the North Carolina School Psychology Association and serves in a leadership role. She was recently the co-chair of the North Carolina School Psychology Association Legislative and Public Policy Committee and is now a committee member where she advocates for comprehensive services, increased access to mental health services, proportionate staffing, and efforts to support recruitment and retention of school psychologists. Her contributions have been instrumental in leading the networking and partnerships that resulted in the organization having several North Carolina General Assembly bills drafted and supported during the 2018 and 2019 legislative sessions. Lee serves as the NASP School Psychology Liaison to the Government and Professional Relations for the state of North Carolina, working with the NCSPA board and lobbyists to follow bills of importance to the profession and advocate. Additionally, Lee is a commissioner on North Carolina Governor Cooper's Commission on Access to Sound Basic Education. She actively seeks opportunities to increase awareness of the mental health needs in schools and solutions to increase access to students. Lee has presented at conferences in North Carolina and at the national level and has written articles to increase awareness on this topic. Welcome to Lee Kokinas.
Thank you very much.
Dr. Mary Whitehouse is a school psychologist who works in 2 elementary schools in Wake County. She works to provide comprehensive services for students, families, and teachers in both buildings. She serves on multiple problem-solving teams, including the intervention teams at each school. Mary also provides direct academic and behavioral support to students in each school. She regularly provides professional learning to her schools on a variety of topics, including social emotional learning and equity. Mary currently serves on the district level Behavior Collaborative, a cross-departmental team working to implement and support emotional and behavioral health for all Wake County Public School students, and the district's crisis team. Within the Psychological Services Department, she is on the department's leadership team and heads up the department's School Mental Health Professional Learning team. At the state level, Mary has served in a leadership role in the North Carolina School Psychology Association. She was most recently the co-chair of the NCSPA Legislative and Public Policy Committee. Regardless of setting, Mary advocates for justice, wellness, and access for all, especially those who tend to be marginalized or considered to be vulnerable populations. Welcome, Mary.
Thank you.
Just a little bit of housekeeping. We are not using the chat function in this conference, and so what you will see at the bottom of your Zoom screen is a Q&A button. If you press that, then you can type in your questions there. I will be monitoring the Q&A, and at points where Lee and Mary would like to take questions, then I will read them off to them. So please feel free to use that function. You are also allowed to upvote someone's question. So if someone has asked the question you would like to ask, you can upvote that so that I know that it's important, or you can make comments on questions that you see there. So without further ado, let me share the slides and we can get started.
And Mary, if you want, I'll take the first couple of slides, and then will you lead in, or the first three, and then will you lead in with the fourth one?
Sure.
All right, let me move
go ahead. I'm
this so that I can get it into slideshow. Play from start. Okay.
So you've had an introduction of who we are. Would you please advance to the next slide?
Yes.
I want to first connect a little bit with the people that we have in our audience. Mary and I do not advocate as a full-time job, although in essence we do as parents. I say I think it's a really good thing for people to know that we both obviously work full-time and we have families. So we have this first slide just to connect with who we are. And by day, we work to balance care for our families with full-time work. We support our children's schools with various activities. We both provide what is known as comprehensive support in elementary and middle schools. Historically, school psychologists have been used primarily for psychoeducational testing and different evaluations in schools. But we both, and everyone in Wake County Schools who is a school psychologist, provides comprehensive services both through a consultation model and through interventions. And we also serve, as you just heard, in a variety of leadership roles outside of our schools. I specifically serve, I used to be on the MTSS team, and I no longer serve on that team because I did that for about 3 years, but I serve on the low incidence assessment team, and Mary serves on the behavioral health collaborative, and we both served on different teams during our time in Wake County Schools. And really important during this time, during a global pandemic and during a lot of social unrest with what we're seeing and what's happening with Black Lives Matter, we practice self-care, that we understand that we have to take care of ourselves, and we make sure to look out for our colleagues in doing that. Will you advance to the next slide? Okay, so this next slide, I like to say it speaks for itself. When we go out and we speak to people in the community, when we're talking even with just families, if we're talking with representatives, if we're talking to commissions, or if we're sitting on committees or on commissions, we are telling the story of North Carolina school psychology many times to many people, and as it says, and then all over again, because what we have found repeatedly is that it's this is a big lift to try to get more school psychologists in our state, to keep school psychologists in our state. So recruitment and retention requires us to tell that story both through personal stories that we live in our daily lives, telling the stories of what our families and children in schools are living on a daily life, in a daily routine, and talking about the data, because there is a statewide shortage of school psychologists. So we're going to get into some of that data within the next few slides. And so if you will advance to the next slide, I'll pass it to Mary.
So the North Carolina School Psychology Association has a variety of committees that serve a lot of different functions. One of those is the Legislative and Public Policy Committee. And our role and function is listed here for you, but it's really about building advocacy skills of our membership, pushing out advocacy resources that are aligned with our standards of practice, that are aligned with our annual legislative agenda, which usually centers on recruitment and retention and expanding access for students in schools, especially in our rural areas. We work really hard as a committee to really promote and advocate for legislation that includes North Carolina school psychologists, particularly around recruitment, particularly around retention. And we're just, again, getting our story and our name out there as much as possible. So we can go to the next slide. This is a list of the annual responsibilities that that committee is involved in, and it's pretty intense. There's a lot of ongoing work that happens all throughout the year, and then you can also see what we do at specific times during the year. Just to highlight a couple of things, we develop our legislative agenda at the beginning of the calendar year, regardless of whether the General Assembly is in a short session or a long session. And so that just means either the General Assembly is going to come back sooner or later during the winter or spring, depending on the year, but we try to have that ready to roll as soon as possible after the new year. At our fall conference, which we do every October, we do an advocacy reception and we provide additional information and resources to our membership. SPAW, which is the October gubernatorial proclamation, SPAW stands for School Psychology Awareness Week. And so that is a week that is occurring in November, usually around Veterans Day, but we try to get that proclamation out and advocate for that to happen in October. And Lee, you can tell me exactly how many years we've been doing this, but we've had a lot of success every year with having that recognition from the governor's office in North Carolina. We do
About 3 years.
3 years.
I think we've done it for definitely the last 3 years, and then we'll be doing it again this year as well.
Yep. We do work with a lobbyist, and so there's some paperwork that goes with that. There's a whole lot of collaboration that goes along with that. And then you can see some of the other things that we are involved in. And then certainly this committee is not the only one involved in advocacy. All of our committees advocate in various ways, and we all partner together within our state association to do a lot of these things, but these are the committee specific functions. So if you can go on to the next slide.
Are you going to do this one, or how do you want to do?
I'll let you take these because you like these numbers.
I do like these numbers. I mean, I wish they would change, but I like them because I'm so familiar with them.
We like them and we hate them at the same time.
These are the numbers that, back to the slide about telling the story many times to many people. This is what I wake up thinking about and talking to myself about when the General Assembly is in session. So the next couple of slides tell the story of what school psychologists are facing in our profession in North Carolina. To give you a little bit of a helicopter view, in the entire country, there is a nationwide shortage of school psychologists. So every single state is working diligently to address the shortage. It is definitely more pronounced in certain states. So, for example, California has a whole lot of school psychologists. In fact, that state doesn't really have a lot of difficulty filling their vacancies. New York doesn't. I think Pennsylvania does a pretty good job of filling their vacancies. And it is the exact opposite in North Carolina. There are about 772 school psychologists employed in North Carolina public schools, and about, let's see, I've got to get back over here to this. There's 772 employed in North Carolina, but only about 743 that are school-based psychologists, because there are some school psychologists who report to a school every day. We provide direct services to our schools, to our students, to our families, and then there's school psychologists that are in lead positions. They're directors. We have a DPI school psychology consultant. We have we have school psychologists who are in positions where they're overseeing multi-tiered systems of support and pushing that forward for schools. So to give you an idea of where most of us are, obviously no surprise, most of us are in urban school districts. Wake County Public Schools has about 115 of us employed, and Charlotte Meck has about 85 of us employed. You'd think that it would be about the same. Charlotte-Mecklenburg schools lost a fair number of school psychologists in 2009, and they are still recovering from that. And I say that with honesty because I do talk with them, and I made sure that before I put these numbers on here, contacted the lead school psychologist for Charlotte Mack to see how many they had in there. In the whole state of North Carolina, we have 1,251 licensed school psychologists. So that's the number of people in the entire state that could be working as a school psychologist. But currently we have about 60% of our employable workforce working in public schools. And I do not have the current statewide vacancies as of May 2020. But I know that as of a year ago, we had 80 statewide vacancies. And then 2 years before that, we had 65. So it's definitely going up. And the bulk of those are in rural districts. Okay, if you want to advance to the next slide. There you go. What this is, it's limited access to mental health services. So that's why when we go out, our big ask is to address the statewide shortage, but to give you even a closer look, you know, and digging in deeper to what these numbers look like. There are currently 22 school districts in North Carolina, all of them rural, have no or less than one-time full-time employed school psychologists. And that what that means for students is that they have limited access to mental health services. But what it also means for, and that's for 1.5 million children in the state. So what does that mean? It doesn't just mean limited access to mental health services. It also means limited access to for students with disabilities, because we work so closely with our special education teachers, our special education teams. We are deeply knowledgeable because we're trained on the Individuals with Disabilities Education Act. So this really reduces access to the students with disabilities to professional educators who are knowledgeable about IDEA and understand the policy, the special education policies and procedures for protecting the rights under the law. And this disproportionately impacts African American children, Latinx children, and children living in poverty. Okay, if you want to advance to the next slide. I'm going to do this next one, and then I'm going to, I might toss it. Let's see, I'm going to do the next two, Mary, and then I'm going to toss it to you, okay? For as far as licensure, we started talking a little bit more about this a few years ago, because one of the big asks for us for the in the General Assembly is to address a non-competitive salary scale that we have. Our current pay scale begins just under $15,000 below the national median pay scale. And what does that mean? Sometimes people say, "Oh, you just want more money," but obviously we're looking at how competitive is our state in filling our cohorts in our universities. How competitive is our state in having a competitive salary for the university, for the graduates from our 5 university programs, in staying in our state and supporting our public schools. We just don't have that competitive salary anymore. And our school, the licensure for school psychologists it's the highest licensure threshold within DPI for professional educators. That actually was very surprising to many people that we spoke with, and I think it was actually surprising to quite a few members and school psychologists across the state. They didn't realize that, but our licensure threshold, it is higher than any other licensed professional educator in North Carolina. We have to have an advanced degree in order to be a school psychologist and be employed in North Carolina schools. But we are not eligible for supplemental pay for our national certification. And again, people may say, well, what difference does that make? That would actually be if we had a supplement for a national certification, similar to teachers or school counselors who have national board certification, that would be a competitive recruitment and retention tool for us. Okay, would you advance to the next slide? Okay, Mary, would you like to take this one?
Sure. So Lee has talked about the vacancies that we have been struggling to fill. There are a couple things that really contribute to those issues. One is this issue of recruitment. So we have 5 school psychology graduate programs in the state of North Carolina. Often their cohorts are not completely full. Their cohorts of graduate students. So they may have, on any given year, I don't know, 5 to 10 slots available for grad students, and they may not fill those, and rarely do at this point. Part of that is because our faculty are limited in those programs, due largely to the fact that the funding for those programs has been reduced gradually over the last 10 years. So when you we are struggling, number one, to get people into the programs. And then once they leave the programs, what we are finding is that the states that neighbor North Carolina pay a good 10 grand more a year on average. And so what we have found is that we've got some folks who will continue to live in North Carolina, because why would you not want to do that? This is a great place to live, but they'll live close to the border, like they'll live in the Charlotte area and then work in South Carolina, or they'll live sort of on the North Carolina-Virginia border and work in Virginia. So we're finding that folks are sort of taking their talents elsewhere because of the pay differential. And because of the student debt that people come out of grad school with. So in terms of why does it make it difficult for us to retain these folks, that compensation piece, it's not as competitive, and we don't have those bonuses for our national certification. The workload is high, and the further away from urban areas that you get, the workload increases because there are fewer individuals to actually do the work and share the workload. And so in those rural districts, a lot of times what we're finding is that our school psychology colleagues basically are doing evaluations for special education eligibility determination and not much else, because they just don't have the time to do that. And I won't speak for all of them, but my position on that is if all I do is special ed evaluations, it will suck my soul dry, and I won't want to do this for very long. And I do think that that is happening for some of our colleagues as well.
Mm-hmm.
Can we go to the next slide? So in terms of equitable access to education, and what does this mean for our students? We've talked about our rural areas not having access to highly qualified school psychologists. There just aren't enough of us to go around. Within our workforce, and I haven't seen a number breakdown on this, but and thinking about a lot of the conversations that are happening around race at this point and representation, and how do we make sure that our Black and Brown students get to see Black and Brown adults doing the work that they might want to do someday. We don't have, it's a largely white female dominated profession, as it is in much of education. And in those 5 training programs across North Carolina, none of them are in our HBCUs. So we're not always pulling from non-white populations as far as having a diverse workforce, attracting a diverse workforce. We just don't have very many pathways to expose our work to a variety of people, to a diverse body of students. And then you've got the student debt load, which is a barrier for so many students, no matter what profession you're going into, and especially with where we are economically right now, and we don't know exactly where we're going to be in the next few years or over the next few years. I think people are going to think twice about, or think long and hard about, pursuing advanced degrees. And when we look at, and I'm going to let Lee talk about this in the next couple of slides. When you look at also our current staffing ratio, we have the highest ratio in terms of the number of psychologists to the number of students when you compare us to other specialized instructional support personnel. So your school counselors, your school social workers, your school nurses. We are hopeful that, especially with a lot of the legislation that has come out, a lot of the money that has been made available with COVID, that some of that's going to get allocated for more school psychologists and that those funds will be recurring, but that remains to be seen at this point. If we can go to the next slide, and Lee, I'm going to let you talk about our workforce data.
Okay, great. As it says, this is workforce data. This is from 2017 to 2019. And I don't mean to keep going back and forth between 2017 and now, but I really do find that people are interested to see that change over time, and really not a very long time. I feel like 2017 was not a very long time ago. So these were the numbers, and this information was from the Department of Public Health, and this was, you can see what the differences are in the numbers, and this is broken into a comparison of other, as Mary said, specialized instructional support personnel, so counselors, nurses, psychologists, and social workers. And that's our, I like to say that's my family. When I'm at work, I am next door to and in meetings with counselors, nurses, and social workers. In fact, after I leave this meeting, I'll be in one with my social worker and counselor. So we have to have that comparison. What we really ideally would like to see is proportionate staffing for all of specialized instructional support personnel. There are going to be some schools that are the same size that may need, as we know, more than one counselor. High schools have several counselors. I work in a middle school. We have 3 counselors, but we essentially have half a school psychologist. So there's 3 counselors at my middle school that are there 5 days out of the week, full time. I'm there half of the week. So my middle school gets, essentially 2.5 days of my time. So this is a comparison, and basically the big picture here is that you're seeing, this is just a quick snapshot, other positions, other specialized instructional support personnel, they're gaining positions, whereas we are still losing positions. And, we have a limited number of recruitment tools to use across districts because many districts have no salary supplement to offer, and our salary is just not competitive with neighboring states, as Mary mentioned earlier. If you advance to the next slide, that will show you something very current and hot off the press. If you wanted to, I go in and out. I do the helicopter view and then I zoom in, but this is the helicopter view. So this is what it looks like across the state. In 2019, House Bill 75, which I think is Session Law 220 or 222, within that House bill, there was a position study that was requested, and that just came out. And the position study was to compare school counselors and school psychologists. It's probably not a big surprise that often school psychologists and school counselors are talked about as though they are the same profession in the school, and they're not. It's different licensure, it's different training. We overlap greatly. We're working a lot of times with the same kids and the same families, and as I said, that's my family at school, but it's different. So if you look at this, you can really see where those disparities are. I mean, the first one on there is on the regions, and these are broken out into the DPI regions across the state. Northeast region of North Carolina, you see how many, the disparity. It has it listed. If you look at that first line where this the Northeast, you'll see that there's 39 full-time school psychologists and 211 full FTE GUI stands for full-time employed guidance counselor, but guidance counselors don't like to be called guidance counselors anymore. They go by school counselors. That's their title, and that's what they're licensed as. So if you just go down in each region, you're going to see a great difference in the number of school psychologists that those regions have and in the number of school counselors that they have. And I can tell you from viewing this, I literally have only had since last Wednesday to look at this, but it's already been identified that there's some inaccurate data in here. There are 3 counties that misreported the number of school psychologists they have. So even with what you're seeing now, these numbers for school psychologists are inflated. I can't speak to the school counselor numbers because obviously I didn't dig into those, but I can tell you with 100% accuracy, because I fact checked it, that there are 3 counties that misreported, and I don't say that as a criticism. I think that they just didn't understand how to report those numbers. But it's our total numbers that have been reported are inflated by about 100 plus across the whole state. So hang on one second. I need to get to some notes real quick. I just want to make sure, see if there's anything else I wanted to say. And as Mary said too, in the rural areas, the same school psychologist, the person that does my same job has far more evaluations than I do during the year. Okay, do you want to advance to the next slide? These 4 critical areas that we're asking for, that we repeat and that we have embedded within our legislative agenda, we have data to support the need for these 4 critical areas of need. Obviously, is sufficient dedicated and recurring funding of positions. Right now, what we're seeing is grant funding that may or may not be recurring. And with grant funding, you're going to get some districts, if they apply, and maybe they might get funding for different things, but they may not. So there's always going to be winners and losers with grant money, recurring or otherwise. We are asking for proportionate representation in all North Carolina public schools. Obviously, the title of our presentation is, mental health access. It's really not okay for a student who is possibly contemplating suicide in Gates County to not have access to a mental health professional. And we would like infrastructure that supports effective teaming. Within DPI, there is currently a position that funds a school counselor consultant. There is currently a position that funds a school social worker consultant that was recently filled. And then there is a school psychology consultant, but she is housed within the Exceptional Children's Program. So there isn't as much flexibility for her to do things that are just specific to school psychology. And obviously what we are constantly trying to do in a number of creative ways is to recruit and retain talented providers. And we work heavily with our university programs in doing so. Okay. Mary, do you want to take this or?
Sure.
Okay.
So this graphic is probably really hard to see at this point, but when you get a copy of the slides, if you choose to peruse them later, this is the whole child model that the North Carolina State Board of Education has adopted in terms of trying to make sure that we are thinking about and providing support and services around all of the needs of our students as they are people and then as they are students. And so if you'll go to the next slide, within that model, there were 10 blue circle-ish, squarish around the outside. These are 4 where school psychologists very clearly fit. We do a lot of work around family engagement. There's not a week that goes by that we're not talking to families in some capacity, either in an IEP meeting, talking about evaluation results or updating a student's IEP, talking with parents around some type of risk assessment that we've had to do, talking with parents about some type of intervention that their student is involved in and we may be a part of in some capacity. So lots of ways that we are connecting with families. The counseling and psychological and social services, obviously the psychological services is where we fit primarily with that. We do, again, as Lee said, have some overlap with counseling and with social services even a little bit, in terms of making sure that kids have access to the things that they need. The primary part of our role that we don't share are those evaluations for the special education process. We're the only ones in the building who can get that part done. Then after that, that's where we work together with the other teams around academic and behavioral health needs for students. We'll provide counseling services when we can. But again, that gets to be difficult with basically being part-time in each school. And again, that's for those of us who just have a couple of schools. For psychs working out in our rural areas, they may cover 8 to 10 schools. And so there's no way they're getting in any kind of regular counseling services with students in those settings. We certainly contribute to the social and emotional climate of the school. There's a big focus right now on social emotional learning. And so we have been brought in to partner in efforts around how does that look for all of our students in our schools, and then what do kids need beyond that? And so how can we, again, partner with our school counselors and our school social workers to meet those needs. And then with school safety, threat assessments, suicide assessments, and human trafficking assessments are parts of our job. The state has required us to do a human trafficking curriculum in grades. Does it start in 6th grade, Lee, or does it start in 7th grade?
7th grade.
That starts 7th grade through 12th grade. So that's done through our health and PE class, well, the health class, that's part of PE, which is where I would also say that we kind of fit into this health education piece, because we are talking about human trafficking. What are appropriate relationships? What are appropriate expectations for relationships? What is an appropriate level of intimacy in relationships? And so that's a piece of that. And then in 7th grade, 9th grade, and 12th grade, we also do an annual signs of suicide training for students. We do that in those grade levels each year. And at the end of that presentation, students have the option to, or students have the opportunity to fill out a form that has a few questions that kind of are a little bit of a screener. And then we follow up with students as needed. And of course, we will do suicide assessments anytime it's warranted, but those are 3 ways that we really get into the health education piece, because we are talking about mental health, and we are talking about who are people that are safe to be with, who are people that are safe to talk to, who are people that you feel like you can go to in this school and outside of school. A couple of other, well, one other area on that whole child model that we haven't highlighted on this slide, but I would advocate for, is employee wellness as well. We've spent a lot of time talking about student wellness, but we're not spending as much time as I would like for us to be talking about the grown-ups. Because if the grown-ups aren't doing well, the kids are probably not going to do well either. And so I think a lot of us are sensing that, and especially in light of COVID, and now with our just kind of the string of the killing of Black people in America that continues to persist, and the racism that continues to persist there. I mean, it's affecting people. And so how do we help our adults be their best selves so that they can educate our kids? I think that's vitally important as well. And that's a piece of the whole child model. So if we go to the next slide.
Do you want me to take this one?
Sure.
This whole advocacy, I don't want to call it a movement. It really was probably, it was pretty big within NCSPA. Just to give you an idea, this really started very small back in 2011, and truly with 3 school psychologists around a table and the backing of North Carolina School Psychology Association. One of those people that started that is on this meeting, and that's Dr. Cheryl Posner Cahill. So she's a mentor to me, and I really want to say, and I do say repeatedly, that this is a grassroots effort within North Carolina School Psychologists. If you want to advance to the next slide. Some of what this leads to is us teaming with other specialized instructional support personnel. This picture is, and some of our advocacy efforts has led us to have a bigger voice in how decisions are made and building people's understanding. This is a picture of just some of the representation of statewide school instructional support personnel after they presented information at the Governor's Commission on Access to Sound Basic Education. And each branch provided the job duties, the current issues impacting schools with different points of views, and provided workforce data and barriers to recruitment where there are barriers. And that was really important for the Governor's Commission on Access to Sound Basic Education. I can tell you, because I'm a commissioner on that commission, that we had heard from several different panels, and I put forth that, you know, there's a lot of people in schools that are doing crucial work to support teachers, to support administrators, and that's this group of people. And it was very eye-opening for the commission to hear about the work and more importantly about the current data and barriers that schools and our state is experiencing right now. If you want to advance to the next slide, please. This is our legislative day 2019. This is the first legislative day that we had, and Melissa Muscari, who is a school psychologist in Cabarrus County, said she wanted to put this together last year, and it was actually me who said, I don't think we can do this. I just don't think we can pull this off. And as you can see, here's the proof that Melissa did pull this off, despite the many barriers that I said that she would encounter. So this is just a handful of school psychologists across the state. This was May of last year, 2019. I can say the busiest month of a school psychologist career. School psychologist school year, because that's obviously when everything is coming due, and it's the end of the school year. But there surely would have been more if it hadn't been May, probably. I really love this picture. I love what it represents for our professional association's efforts. And included in this picture are students. My practicum student from last year is in there. University trainers, lead school psychologists, directors, a DPI consultant, and many school level practitioners, 2 retired school psychologists, and a national speaker. So we pull everybody into this, and I love that we do that, because it truly makes a difference, and you have to have all those voices in there. Okay, if you want to advance to the next slide. This is another picture highlighting we involve our students who are entering the field and have retirees who support our efforts, because when we're talking about recruitment and retention, we have to involve students. We have to involve the university trainers, and that's Jim Denny, and he's at Appalachian State. He's like the grandfather of school psychology in North Carolina. And then on the left-hand side, Jerica Knox, who is a PhD student at NC State, went with Debbie Murray, who is a retired school psychologist from Carteret County, and they helped deliver our legislative packets last year to the General Assembly. And then in the upper right-hand corner, Linda Johnson, who passed away just a few months ago, but she really listened to us, and she was a big proponent for school psychologists, and that's 2 of her constituents, Amy Louder and Melissa Muscari, talking to her, and then we've got in the bottom students. So we say all in students, practitioners, and retirees. All right, if you want to advance to the next slide. This is, we always want to have a little bit of progress monitoring to say what are we getting? What is our advocacy effort getting us? This is seats at the table. You can't be a part of the decision making unless you have a seat at that table. And a decade of advocacy has led to us having statewide seats at the table. The Governor's Commission on Access to Sound Basic Education was a big win for us to have representation on that seat, and for them to have a school psychology seat reserved was enormous for us, and has given us a voice in being recognized in the recommendations that have come about from the Leandro hearing. So that was that's huge for us. But we've also across the state really encouraged our members and school psychologists to get on local commissions. So this is a list. We had the state superintendent's working group, or excuse me, we had representation on the state superintendent's working group on student mental health and well-being. We've been on NCDPI's School Safety Commission. We had some school psychologists in Guilford County who were on a school safety committee. And we were invited to attend the Governor's Crime Commission Special Committee on School Shootings after the Parkland shooting in Florida a few years ago. And we have also had different school psychologists, lead school psychologist and our DPI consultant present at 3 different times, 3 different presentations at the House Select Committee on School Safety. And that's been, that it is another way for us to get information out there and another way for us to increase that access for students to get mental health services in school. All right. Mary, do you want to take this next one? Next one is a big one.
Yeah, I'm happy to do that.
Okay.
So this is just a sampling of some of the legislation that has occurred most recently. And that first bill that has passed and been signed into law, we are now mandated by the state for every K-12 school unit to have a school-based mental health plan that includes a mental health training program and a suicide risk referral protocol. So for those districts and schools that have not had one, they are now mandated to do so. And school psychologists are very much a part of that. In Wake County, we've been doing this for a long time. We deliver with our school counselor and our school social worker every year. We train all of our school staff on signs for suicide, child abuse of any kind, any type of homelessness, living in transition, and then how do we respond when we think that some of those things are going on. So we've had protocols in place for a while in Wake County, but this is now mandated statewide. With the COVID Recovery Act, again, there's a lot of money tied in that, where we're hoping that school psychologists will benefit from some additional funding so that there can be more of us and more positions filled in our state. And we hope that that money will be there long after COVID is gone. The Student Health Collaborative pilot is going to be an interesting one to watch. It's not signed into law yet, but basically establishing a pilot to see if between DPI, Department of Health and Human Services, other social service providers in the community, how do we work together to make sure that kids in our schools are getting access to those community providers? And it may even take place in the school setting. So we're waiting to see how that's going to go. Everybody's concerned about student mental health and well-being. I'm concerned about everybody's student mental health and well-being in light of COVID. And so the General Assembly is considering those things as well. So the legislation that is attached to this current virus, I think will be really interesting. And I'm hopeful that it will provide us with some resources that we've not had to date to be able, because I think the response at whatever point that we do go back to school, and whatever form that's going to take, I think there's going to be a lot of work to go around. So if we can go to the next slide. I'm also mindful of time. And we're almost to the end, and I want to make sure we have time for questions because I know there's a few. Some of the things that we have experienced and gotten some big wins on, you see here on the screen, the Forgivable Educational Loan Service. So we are one of those professions that are eligible for loan forgiveness, which again, if one of the barriers is the potential for student debt because you have to have an advanced degree to do this work, how do we solve that problem? This is one way to do that. This did not happen in the General Assembly, but we did get NCSP reciprocity for our DPI licensure. So that happened within North Carolina Department of Public Instruction. Basically, if you're a school psychologist from, as an example, Arizona, and you have that national certification, and you move to North Carolina, as much time as it can take for your DPI licensure paperwork to go through, North Carolina says, we'll honor that national certification as though you have a state license. until your license comes through. So you can go ahead and start working immediately if you have that certification, which has not been true historically. And then a couple of bills where you find some grant money for districts and for school safety funds and programs and supports. And we have benefited from that this year, especially from the school safety grant. Wake County wrote a grant and was awarded money to train all of our psychologists, counselors, and social workers on the Coping Cat program, which is specifically for students with anxiety, and then the Zones of Regulation program, which is, as you might guess, for working on emotion regulation. And so we've been able to expand our skill set just with some of that funding as well. We can go to the next slide. You can see here our continued and ongoing and future directions. Some of those things we've already talked about as far as what we're doing. We would like to build a larger community of practice. We got a small grant from our national association to work towards that end, so we're still trying to make that happen. And then it would be really incredible, I think, to have a school psychology training program at an HBCU, preferably one in North Carolina, because we want to recruit and retain the talent that comes here. And the last slide, because we've talked about a lot of all those other things. If you are looking for more information, NASP is the National Association of School Psychologists, and their website is there. They have an advocacy tab on the menu across the top of the website, and you can see
I actually meant to put NCSBA online.
Well, we can give you both of those. The NASP will give you sort of from the federal view what's happening at the national level, and then our state association will get that to you all as well. Gives you more about what we are doing in North Carolina. So that's it for slides. I know we've got a few questions, so I wanted to make sure that we've got some time to address those.
Yes, we do have a couple of questions. Let me stop sharing the screen. Okay, so you guys talked about how there are differences between what school counselors and school psychologists do in terms of the work that each does with students. Could you just talk about that difference a little bit?
Mary, do you want to start? Or
Sure.
Yeah.
So I touched on it a little bit. Again, the part of our job that nobody else can do are those evaluations for special education. And then outside of that, we expand and provide as much direct service as possible. Where we overlap with counselors and social workers is providing one-on-one or small group counseling, and sometimes we'll even partner with our counselors and social workers to co-facilitate that so that we share the workload a little bit that way. Another place that you are likely to find a psychologist that you may not find a counselor or social worker consistently is on our intervention teams. We have the most training in data literacy and data use. And so we are, I think, vital to our intervention teams as far as looking at and interpreting the data and trying to determine, is a student actually responding to this intervention as we are implementing it right now? And if they are, great, let's keep going. And if they're not, what do we need to do differently? And how long do we let this thing go on before we say, we might need some more information from an evaluation? Counselors and social workers often will, or at times will come in if there are some extenuating circumstances, or if there's some more significant mental health needs that the psychologist is not aware of, or some social service needs that the psychologist is not involved in. But by and large, the psychologist is invested in that process much more than our counselors and social workers are.
I'll add too that counselors also have a career in college ready focus that would not be the focus of a school psychologist. So what you're going to see is the character education, but also like at elementary and middle school, you're going to see a big focus on how are they being exposed to different careers and what kinds of things, what kinds of activities are going on around that, in addition to, in addition to social emotional learning skills as well. So that focus would be different, but you wouldn't see a school counselor doing testing.
Right.
Thank you. Next question, do children in districts without full-time psychologists have access to contractors or to other resources?
They will. They have to, because they have, once a child is referred, if they're suspected of having disability and they're referred, they have to be tested. It has to be within a 90-day time frame. So school districts will have to use money, allocate money for contract services. But remember, they're pulling them in to do just the testing. So then they're not even necessarily going, the school psychologist that would be contracted in a district doesn't come in and participate in the meeting. There's no follow-up. They're brought in and they're test only. So once the testing's done, they submit the report and they're done. They're gone. There's no comprehensive piece to that.
Thank you. Another question, are you, and I think we mean school psychologists here, represented on the school reopening commission that State Superintendent Mark Johnson has announced?
I don't know.
I'm not aware of it, but I certainly would like for somebody to be there at the table.
I don't know. There's a lot of things there's a lot of balls in the air right now that we're juggling and trying to keep up with, and doing our job as well by the day too. So good question. I'm going to check.
Yeah, I will say, at least in Wake County, psychologists are at the table on our district's reopening plan as far as how do we support reentry, because this will have impacted a lot of people in a lot of different ways. So, but at the state level, I don't know.
I have a question, which is, what, if anything, can we in the League of Women Voters do to help with either funding or, what is it that you would be looking for in terms of advocacy?
We would, meaning North Carolina School Psychology Association, would love to be able to provide someone with an infographic that's a quick visual way to tell the story of school psychology. And the bigger advocacy here is increased access to mental health for children. But in order to get increased access to mental health for children, school psychologists are needed in every single school district, and there has to be proportionate staffing. So if there is a way and for League of Women Voters to support that, we would be very grateful for that. But it's ultimately not about it's ultimately about getting more access to children, and the tools, the levers that are available to do that have to be a competitive salary. They have to be it has to be more funding to get that access across the state, because we're headed into more budget cuts, and there's no school district that has fully recovered from the cuts from 2008 and 2009. They're all still reeling from that. So as much as I advocate for, my own schools that I go to, I always mention rural school districts. I know what's going on in those rural school districts, and superintendents will tell you that their priority is that social emotional learning, that mental health. In fact, I said to one of them in a meeting that we had, remember, we're highly skilled on matching up interventions, kids who need interventions with the right intervention. He said, I get that. He said, mental health needs are overwhelming us. We do not have enough people. And if I see that in my school that's 5 minutes from my house, I cannot even imagine what it's like in a district that you just can't pull somebody and say, help me right now. I don't know what they're doing. But it's not, whatever is happening, it's with limited resources, and that hurts kids. And that's not good overall for our entire state. It's horrible. But I can get you an infographic.
Thank you. One more question. As a parent of a child who had mental health needs, I would like to see insurance parity. I'd like to be able to get services for my child on par with those who have a sore throat. So that's really a comment more than a question. Did you want to speak to that?
Me too. Me too. I get so frustrated personally and professionally with the limitations to quality mental health services, because they are out there, but there are so many barriers to so many families to be able to access them. And yes, I'm right there with you. And I mean, I've even walked with some of my own close friends dealing with the same kinds of things with their children. And it's like, we have got to have help right now. And the only way to get help right now is to go to the hospital.
Mm-hmm.
And that it doesn't have to be that way.
All right. Well, we have reached a couple minutes after 2. I want to thank everyone who has attended. I especially want to thank Lee Kokinis and Mary Whitehouse for this presentation. And I want to give a special thank you to Sally Penix for having alerted our education roundtable that you guys would be willing to speak with us. So thank you very much. And I'm going to close out the webinar. And
Thank you to all of League of Women Voters, to
Yes.
Sheila and Sally and everyone for putting it together.
Oh, thank you so much. And I personally am very glad that you all are doing the work that you do, and I hope we can help you in some way. Thank you.
So. We love what we do, by the way, too.
All right. Good afternoon, everyone.
All right.
Bye,
Thank
everyone.
you. Bye-bye. Thank you.